Well, speaking about healthy planet, healthy lives, we're going to continue discussion on planetary health. So I'd like to invite Jenny Ravelo back to the stage. If you haven't yet, also check out our focus area on planetary health. It'll be in some of the resources you'll find and the QR codes that are around. But over to you, Jenny.
Thank you, Kate. So the panel before us, we focus very much on human health, right? But there's so much interconnectedness in everything: our health, our planet, the trees, the animals. So but before that, I just want to introduce our panelists for this event, for this one. We have Marcene Mitchell, Senior Vice President of Climate Change for World Wildlife Fund in the US, Dr. Alex Dehgan, founder and CEO of Conservation Labs, and Jessica Beagley, Policy Lead, Global Climate and Health Alliance. Thank you so much, everyone, for joining us. So let me start with Marcene. This interconnectedness, really, from different sectors, can you maybe set the stage for us here? How interconnected really all of this are, the challenges and the solutions?
Yeah, so really having a healthy planet is key to having healthy human beings. I mean, these are the ecosystems that provide us with clean water, clean air, and the biodiversity that we really need to pollinate our food, to do all of the things that we need to have a healthy lifestyle. And so it is interconnected. And then also, and particularly with climate change, as it is impacting our our landscapes and our atmosphere, it also impacts us in health. So in climate, we often focus on carbon, right? This is what we're putting up in the atmosphere. But the sources of these carbon, which is basically burning fossil fuels, also has huge impacts in terms of our, what we're breathing and the other pollutants that are coming into the air. And so I don't know if everyone's aware that every year, over 7 million people die from air pollution. 7 million people. I mean, I hope you've heard that statistic, and I hope you repeat that statistic, because it's something that we don't think about. Many more than died during our pandemic, which was a world crisis. But every year we accept that 7 million people. So it's those same things that we're putting into the atmosphere, we're putting into, for carbon, we're also putting into the air that we breathe. Interconnected.
I'm interested in solutions, right? And I wanted us to maybe focus more on that, on those collaborations. Can you maybe give an example of collaborations that's working really, that's benefiting not just human health, but also the health of our planet?
Yeah, so we have, because it's such a massive challenge for all of us, not one organization, not one country, not one, group of people can do this alone. So we are finding that we're doing more collaborations with people, particularly around the health and leadership. Coming in, sorry, the health and leadership. Can you hear me? Okay, the health and leadership. So WWF and CARE has an alliance, and it's an alliance. One of the programs under the alliance is called Sow for Change. I mean, we're a conservation organization, and we are in rural and natural landscapes all over the world. And we're finding that the climate being changing, particularly issues, and I think was brought up in the last panel, of drought and things of that sort, are really impacting. So CARE and WWF are working with a focus on women and building women's leadership and building their capacity to be able to use their own wisdom, use the wisdoms of their community to lead in terms of climate solutions, in terms of resilience, in terms of reorienting their agricultural systems, which is being absolutely impacted by drought and water, being able to find different livelihoods as well. So those are the type of solutions that are really working, and using nature-based solutions to do this. Often, in the West, we think, let's throw technology at it, let's throw, to come up with things. But actually, nature is some of the best solutions that we have. And by using the traditional wisdom and merging it with technology, we can have solutions that really work for people and for the communities that they're living in.
Alex, I want you to build on that because you work on conservation, you're working on technology. Maybe you can give some, solutions and collaborations happening in the space.
Yeah, so we had built a handheld molecular lab called the Nabbit, and it is accuracy of a lab-based PCR, ease of use of and cost and speed of the lateral flow. And so we're working on wildlife trafficking, fish traceability, timber trafficking, and COVID hit. And we realized having a device that works in the field, no sample prep, a 6-year-old could use, that is low cost and democratized, could actually be very powerful for what we're doing. And we got into this program, Operation Warp Speed. There's 2 sides. People know the vaccine side. There was another side called RADx, which was the diagnostic side. And we developed this test for COVID for under the NIH and working with other institutions to start doing this. And we started looking at spillover and thinking about spillover and emergence. And you know, if we think about emerging infectious diseases, COVID was not our first pandemic. It will not be our last. You know, 75% of those diseases are shared between wildlife, humans, and animals. And they're emerging at faster and faster rates, right? So if we think about COVID, right, we know that why has this happened? It's because I'm an evolutionary biologist, right? We are selecting for rapid changes in pathogen biology because of climate, because of habitat fragmentation, because of wildlife trade, because of environmental pollution. And in fact, that speed of selection is actually driving mutation, and that affects vaccine development and efficacy. It is affecting our therapeutics. There's a reason your rapid tests don't work as well. If you notice it and you have COVID, it takes a longer time before it detects it. It's because it's moved on. And we're seeing events like the fact that there was a study by the Carey Institute for Ecosystem Services. They surveyed 5,000 mammals, and they found 2,500 of them were effective carriers of COVID, right? 10% of them, 500 of them, were highly effective carriers. 40% of the deer in the Midwestern parts of the United States carried COVID. 17% of New York City rats. Next time you see a rat on the subway, there's a chance, 1 in 5, it has COVID. They believe that Omicron, the last major pathogen that we had of COVID, actually happened through a spillback event, which meant it originally went from wildlife to humans, then humans to wildlife, and then actually mutated much faster and came back to affect us. So not thinking about biodiversity within what we are doing and not thinking about conservation as a strategy for health is critical, and not addressing issues like climate change that are driving disease spread, disease activities, vector control, regulatory agents, all has a major effect on what we're doing. So we are right now developing tests for Ebola. These are called filoviruses, Ebola, Marburg, Congo Crimean hemorrhagic fever, Nipah, all the winners, right? Nipah, Mpox, and coronaviruses, and are starting surveillance at points of deforestation, wet markets, wildlife trade, to specifically see how we can use ideas of landscape immunity, conservation, pandemic parks, and conservation activities as a global health solution. And those activities are ones that we're doing with folks at USDA and something called the National Bio and Agro Defense Facility. That is probably where the next zombie epidemic is going to happen. When you see the outbreak, it's in Kansas. That is where it's going to, you'll see a film about this. But looking at those areas, like working with them, working with BARDA, which is a biodefense, biosecurity facility within human Department of Health and Human Services, working with USAID to be able to do this kind of partnership across food security, human health, and wildlife is critical for us to be able to prevent the next pandemic, to minimize the costs of spillover. So that's one example of a solution. And we're a small organization, so we've created this idea of an app store to actually allow other people to put their assays on our handheld device to allow us to do this. And ultimately, we want to build this with partners in the global south so we can start tracking the rate of mutation of these pathogens before they develop.
I love that, focusing on surveillance and not just, I know there's a lot of talk about, vaccine manufacturing right after COVID, but also really looking at how can we prevent, the next pandemic and not just be prepared for that. Jess, I want to go to you because health sometimes sometimes, but likes to work in silo, right? But how would you describe collaborations now that we're learning more and more about, this sort of impacts of climate and how interconnected this to different parts. And maybe you can share, some successful collaborations that you know.
So there are so many solutions across sectors that are wins for climate and that are wins for health. If we look on the mitigation side, interventions to reduce emissions in the energy sector, in the transport sector, in the food sector, like transitioning from fossil fuels to renewable energy, like transitioning from vehicle-dependent transport systems to those that promote and enable walking and cycling, like transitions to healthy and sustainable diet. They help us to prevent non-communicable diseases through better air quality, increased physical activity, better nutrition, and that could, that's the vast majority of the global burden of disease, all of that while reducing emissions. The economic implications of that are also really clear. There are parts of the world in which interventions to improve air quality and reduce emissions pay for themselves really, really rapidly. So that's the mitigation side of things. In terms of adaptation, it's also really key that we think across sectors and we strengthen collaboration at national level. And we've already heard a little bit from Marcene, but thinking about how we make sure that sanitation systems are resilient, agriculture systems are resilient. Without that, we're going to see increases in waterborne disease. We're going to see increases in malnutrition, things that global health and development should have left behind decades ago and that are only going to be exacerbated by climate change. Making sure that people have safe shelter, whether that's the building or the wider city that they live in, so that they can be resilient to an extreme weather event. But we don't see this working across sectors. There are tools that can help us to make the case for doing this. There's tools by WHO that help us to quantify the health and economic co-benefits of working across sectors. I think I'll leave it there for now.
How do you think we can do more of this kind of, collaborations? Is knowledge enough, or do we need, these sectors to kind of learn more of this to be able to collaborate? Marcene.
Yeah, I think collaboration, it's always complicated, right? When you have two different organizations with maybe different areas that they're focused on to collaborate. But as I said, these problems are so big that we cannot do them anymore. Let me give you another example. So with healthcare, and I think you said this very well, healthcare is, important on both the mitigation side and on the adaptation side. So on the mitigation side, and people may not realize, but globally, healthcare contributes 4 to 5% of global emissions. That's bigger than the airline industry, which is about 2 and 3%. So we worry about, traveling and whatever, but healthcare is actually significant. So WWF it runs an organization called America's All In. And the concept behind that is you need all of society in order to solve the climate problem. It's not just federal government or not even states and cities, but everybody. And so it's healthcare, it's universities, it's research, it's, museums, all of those. And so we have this partnership with an organization called Healthcare Without Harm. And we've worked with them to decarbonize their facilities. And that means for them to help them with putting solar panels on the roof and using geothermal, which they happen to be in a location where they can do that, and really working on the cleanest electricity, the cleanest services that they can provide to the things. And so that's a great idea. And then we publicize that. We help everybody replicate that across, this is in the United States, across the United States. So those kind of things to bring awareness to people, to bring education about some of the latest things. And I'll just say one more thing on the adaptation side. So for healthcare, at least in the short term, one of the biggest impacts on human health from climate change is heat. And I don't know if people realize that we think about all these, very dramatic storms and floods and things like that. That's what we see on the TV, but it's actually heat that is the biggest piece. So last year in 2023 in Europe, can you imagine how many people you think died in Europe from heat related? It was like over 37,000 people in Europe. I mean, this is not other places, this is in the Northern Hemisphere, okay? So heat is key. So for healthcare, it's an area of concentration in the early days. We need cooling centers. We need resilience centers. You're in our communities, and this is an area where we really need to be aware of and to reach out to the communities to make them aware. Because if the electricity goes down and you're an older person and it's hot, that's going to affect you. So this is another place where partnerships with community organizations, with health organizations can make a really big difference. And it's kind of one of those hidden things that we don't know about.
we've heard earlier, I think, if I remember correctly, the number of talking about climate finance, about less than 1% of climate finance actually goes to health. But I do want to ask Alex, how much climate finance actually goes to some of this conservation efforts, some of this nature-based solutions?
Yeah, I don't think very much. And, Andy Dobson and a group, Stuart Pym, a whole bunch of very famous conservation biologists did a paper in Science, a series of economists, where they calculated what would have it cost to reduce that risk of COVID actually happening through nature-based solutions, as you were saying. And it was, COVID cost us over $1 trillion in counting. And, hundreds of millions of lives around the world, huge amounts of not just mortality, but morbidity in terms of what we've seen. It was 1.1 plus trillion. I think 80 million people went back into extreme poverty as a result of it. And the price was somewhere around $25 to $30 billion a year, which is nothing given the size of what we're doing and the rate at which pandemics are spreading as a result of what we're doing. And so, thinking about finance and thinking about the investment, it is not a very big investment to actually help minimize some of these risks and the co-benefits of preventing deforestation, right? Artisanal scale mining was responsible under Bolsonaro in the last year for 10% of Amazonian deforestation. It is also the #1 source of mercury pollution in the world. It's driven by the tablets that you're all reading right now instead of listening to us. And the thought is fundamentally, right, we are driving that trade, and mercury pollution also reduces our immunity to the diseases that we're helping spread, and it changes the landscape to 1/3 water that now is breeding grounds for mosquitoes that give us dengue and malaria. So if we're thinking about solutions of how we should address this, we need to think upstream. And we need to bring together, there is at USAID, I was chief scientist at USAID, there is way more money for health than there has been for climate or biodiversity protection. And they finally just actually are trying to put climate change.
How do you think we can unlock that? Unlock more of that kind of money instead of just focusing on
100%.
How? Like how?
Well, one of the limitations is actually how we congressionally budget the money. There's limitations on, we can't use health money at USAID for climate change or for biodiversity or for thinking upstream. We don't think about these things. The previous pandemic I worked on at the State Department, we spent like $9 billion responding to SARS, right? And I had written a memo in 2005 that said we need to think about these upstream factors: climate change, deforestation, the pet trade. And I was told at the time it wasn't important. And it was kind of stunning to me, because I sent it back to the person who was head of policy planning at the time and said, hey, when COVID happened, and I was like, do you remember this memo? But I think part of it is like we need to inform Congress. I think the second part is we need to actually transform how we train doctors and how we train development people and how we train conservationists. Conservationists should be trained in health and understanding the spillovers. Development professionals need to break down the silos that exist between these other areas. And our health professionals, right, and our physicians should understand the morbidity and mortality that comes because of climate change and how we think about it, and help being part of the solution, as you just said, about decarbonizing healthcare.
I just have 1 minute, but I do want to ask each of the panel, maybe start with Jess. We heard a lot about Health Day. There's $1 billion that was announced just before Health Day. There was another over 700 million on NTDs, but there's all of this finance being shared, but some people are saying, well, most are saying like it's a big win for health, right? But I do want to ask, like, this COP, did it help in terms of kind of breaking down the silos and allowing for more collaborations? And is that something that we can expect in future COPs? Jess.
So first of all, to say that 100 billion that was announced for health on Health Day is a huge leap forward. And it's also really crucial that we look at where the money comes from and where the money goes. We know that we need action in the health sector, both on the mitigation and the adaptation side. But if we only look at the health sector and financing climate action in the health sector, then we've missed the point. There'll be people at the doors of hospitals way beyond the number that those hospitals can treat unless we take holistic action across sectors. So that finance absolutely needs to address climate action across sectors. And if that could be incorporated into funding calls to make sure that there are joint proposals across sectors, I think that would be really beneficial. It's also really, really key that that finance addresses the needs of communities and that it's based on grants and not on loans, because we know that loans with high interest rates are only going to exacerbate cycles of debt and poverty and ill health resulting from that.
Marcene?
I guess if I want to leave something with you is that, you know, the climate change and the health impacts are going to mostly or first affect or most severely affect those who are least represented, who have generally hasn't had a voice. We saw this in the pandemic of who was really hurt by this. And so I would really urge that these partnerships we've talked about really bring in the community voices. The health industry has the ability to help bring in these community voices and bring in the wisdom of folks who are really living on the front lines, whether it's in rural areas in the global south, was it in urban areas in countries like mine in the US. Being part of that solution and reaching out to those communities are going to make a big difference.
Alex, last word.
Yeah, you know, we've always talked about in medicine about preventive medicine. I think we have a chance to talk about preventive sustainability. That's what I'd like to see in terms of our thinking.
Well, thank you so much to our panelists. Can you please give a hand to our panelists here?